coming from the opposition. It is our view that Jamaica could have been in a better place, could have done better had some of these recommendations been accepted and implemented in a timely basis. Despite inadequate testing generally, we have had almost 50,000 cases with over 900. As an opposition, we have also added our voice to those in the international arena calling on rich countries to share their vaccines with countries like Jamaica. We have called for vaccine equity because the world cannot be safe if one country is not safe from COVID-19. Because every day, the concept of herd immunity stretches further and further away. In March 2021, Jamaica started, despite all the common sense positive suggestions concerning the COVID-19 pandemic. I want to urge the ministry and the minister to develop a special message of appeal focusing on this issue of vaccine hesitancy. Madam Speaker, I now turn to a very vexing problem for the people of Western Jamaica. And let me say plainly, we are not pleased with the debacle at Cornwall Regional Hospital. The Cornwall Regional Hospital continues in its delay and is unlikely to meet its completion deadline because when you look at the 2021-22 fiscal year allocation, only 1.3 has been made available for Cornwall Regional Hospital and 1.14 for the next financial year 22-23. It is therefore our estimation that these allocations will be insufficient to do the work and hence completed date of 22-23 will not be met. In the meantime, Madam Speaker, the people of Western Jamaica suffer the indignity of poor and non-existent critical medical services. We have been given excuses such as delayed government procurement guidelines for why the work has not been completed or has been dragged out. Madam Speaker, non-communicable diseases constitute a significant part of the morbidity of this country, and we commend the concept on which Jamaica moves seek to promote. The question is, what happens to the present? Those living in it now. What of the many NCD patients who will require kidney dialysis, renal dialysis, and unable to undergo the exercise regimen, or the facilities cannot accommodate the number of needy patients? We cannot have these persons left behind because we would be committing them to premature death. That the wait by patients requiring dialysis at KPH is about 4 years. Many have died during this period waiting for acceptance into the program. But someone has to die for a space to be created. Madam Speaker, I raised the National Health Insurance Scheme in my last presentation last year as a concern after it appeared to have been abandoned. When the Minister reported on May 29, 2021, we received no positive update on the scheme except to say it is a national conversation that must be had. He has been leading that charge for more than a year with no new development, noting nothing new. For a long time, the people of Portmore have been promised support services to enhance and enrich their life experience in their community of choice. Throughout the development of Portmore, residents have dreamed of a municipality providing a wide range of governmental and non-governmental services to remove the urgency to travel to Kingston or Spanish Town for linkages to life necessities. With a population of well over 150,000, we believe the case or justification for a hospital to support the continuous expansion of Portmore has arrived. Other townships with lesser population and serving smaller catchment populations have hospitals. I now turn to the issue of nurses in this country. As a nation, we have become accustomed to training nurses only to have them leave for greener pastures, where remuneration and terms of employment are much better. And currently is that as soon as they graduate from nursing school, they are recruited. Their licensing examination fees are paid by the recruiting hospital, and they immediately travel to those jurisdictions to start working. Whilst the salary is a critical component, conditions of service, security of tenure, and a pension remain attractive for many of them. The reality is that the vast majority of nurses who graduate have student loan to pay, as nursing school is no longer subsidized by the state. Madam Speaker, what if, as a start, and Prime Minister, the government decides to absorb all student loan repayment for the graduates and bond them for a period of 3 to 4 years until the issue of pay and conditions of service can be addressed? Is it possible to give scholarships to all 500 trainees each year in the 9 recognized nursing schools and have an element of an in-service program as part of the repayment option. The number of nurses employed by the government and work in the regional health authorities are on contract. This means that there is no security of tenure, no pension to receive at the end of their working years. And yes, although they are entitled to a gratuity, this cannot be the route for employment for such a critical cadre of the healthcare force, which has oftentimes been called upon to protect this nation. Madam Speaker, a study commissioned by the administration of 2007 to 2011 on the Regional Health Authority has made some interesting recommendations which have not been acted upon. One of them, Madam Speaker, spoke to the inconsistency and quality of care in each of the 4 regions. It's also said that these regions have not been uniformly treating patients as per the national imperative. Why do we see fewer number of COVID-19 infections, but our deaths from COVID-19 increasing? We have expressed our disappointment in the overall management of COVID-19 pandemic by the administration. Throughout this experience, we have offered suggestions to many of the challenges to improve the situation and to bring our country to as close to normal as possible. Since we have concluded that despite the availability of vaccines, our protocol must remain, we will urge the government to 1. Increase the number and access to the specific and overly sensitive antigen testing kits as a deliberate strategy to lower the costs, especially for persons on low to moderate incomes. 2. Open the market for more players to bring in these tests. It's only 2 companies that are allowed to import these tests into Jamaica. That's a question that needs to be asked. 3. Allow antigen testing to be a point-of-care test so that medical doctors and government health centers and hospitals can have access to rapid testing of clients or patients who present themselves to these facilities. 4. Maintain the requirement that all persons arriving at our port of entry have a COVID-19 negative test at most 72 hours old, whether visitors, journey nationals, or Jamaican residents. 5. Introduce a new phase of messaging which is culturally appropriate and relevant to the stage of the vaccine campaign. We would also urge, as a 6th recommendation, that the government establish renal dialysis facilities at each regional hospital as an initial start, and later at major Type C hospitals. By the time Jamaica moves kicks in, we might not need to go further. 7. Incentivize the nurse training program by giving scholarships, paying down the student loan for nurses, and bonding them to service. 8. Implement some of the recommendations of the Regional Health Authority study. 9. Commission the establishment of a hospital in Portmore. 10. Honor all contractual arrangements with healthcare workers and pay them on a timely basis. 11. Pay over COVID-19 allowances with dispatch. Madam Speaker, health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Interestingly, Madam Speaker, that definition has remained the same since 1940, long before the member from Southwest was born. We in the opposition subscribe and are supportive of this affirmation. We have in our many deliberations and suggestions worked towards this being attained by the people of Jamaica. We have and we will not resile from this position as we work with the government and all Jamaica to pursue equity in a health system that provides for all. Without that state of complete physical, mental, and social well-being, Jamaica cannot advance on the maximum index of health from the current 29 that we currently stand at to over 90, which is desired as an optimal goal.